Can GLP-1 medications cause shortness of breath? Let's talk about what you need to know and when to seek care. Before we dive in, a quick note. This video is for educational purposes only and isn't a substitute for professional medical advice. Always talk to your healthcare professional about your symptoms. So here's the bottom line up front. Shortness of breath is not a recognized direct side effect of GLP-1 medications, though breathing symptoms can happen indirectly through things like dehydration or rare allergic reactions. If you're taking a GLP-1 medication like semaglutide or tirzepatide and you're wondering about breathing issues, you're not alone. Let's break down what the research actually shows. First, some context. GLP-1 medications are widely used for diabetes and weight management. They work by slowing digestion, reducing appetite, and helping control blood sugar. Like any medication, they can come with side effects, and some people have reported breathing symptoms while taking them. Here's what you need to know. According to FDA prescribing information, shortness of breath isn't listed as a direct side effect of these medications. There's no established mechanism by which GLP-1 drugs would directly affect your respiratory function. That's an important starting point. But that doesn't mean people aren't experiencing breathing symptoms. It just means the connection is likely indirect. So what could be happening? One possibility is dehydration. GLP-1 medications commonly cause nausea, vomiting, and diarrhea, especially when you're first starting or increasing your dose. If these gastrointestinal side effects are severe, they can lead to dehydration, and dehydration can absolutely make you feel short of breath. Another indirect cause relates to delayed gastric emptying. That's actually one of the ways these medications work, by slowing down how quickly food leaves your stomach. In certain settings, like before medical procedures, this delayed emptying may increase aspiration risk. If you're scheduled for any procedure, make sure to follow your clinical team's guidance about when to take your medication. There's also the possibility of a rare allergic reaction. Hypersensitivity reactions can include respiratory symptoms. These are uncommon, but they're serious when they happen. Now, here's something really important. There may be alternative explanations that have nothing to do with the medication itself. If you have underlying cardiovascular disease, that could cause shortness of breath. Obesity-related respiratory conditions might become more noticeable as you're adjusting to treatment. GERD, which is acid reflux, can be exacerbated by these medications and sometimes feels like breathing difficulty. Anxiety can also cause a sensation of not being able to catch your breath. Or you might have a concurrent medical condition that's completely unrelated to your GLP-1 therapy. This is why a thorough clinical assessment is so important. Don't just assume it's the medication. Let's talk about when you need emergency care. If you experience sudden severe shortness of breath, chest pain along with breathing difficulty, facial swelling, wheezing, blue lips, or if you can't speak in complete sentences, call 911 in the US and get emergency help right away. These are signs of a potentially serious situation. For less severe symptoms, you should still contact your healthcare professional. Don't just push through it. They can help figure out what's actually causing your symptoms and what to do about it. What might management look like? Your doctor might adjust your dose or recommend a temporary hold on the medication while they investigate. They might identify and treat a respiratory or cardiac condition that's the actual culprit. The key is identifying the underlying cause. Here's what you should not do. Don't discontinue your GLP-1 medication on your own without medical guidance. The only exception is if you suspect you're having a severe allergic reaction. In that case, stop the medication and get emergency help. If you're experiencing mild breathing symptoms, talk to your healthcare provider about your options. They might recommend staying well hydrated, especially if you're dealing with gastrointestinal side effects. They can evaluate whether the medication needs to be adjusted or whether there's another condition that needs treatment. Remember, these medications have significant benefits for many people, but they need to be used safely and with proper medical supervision. So let's recap. Shortness of breath is not a recognized direct side effect of GLP-1 medications. If you're experiencing breathing difficulties, it could be from indirect causes like dehydration or gastrointestinal complications, or it might be completely unrelated to the medication. Always consult your healthcare professional to determine the actual cause and appropriate management. Have you experienced any unexpected symptoms while taking a GLP-1 medication? Drop a comment below, and if you found this helpful, hit that like button and subscribe for more evidence-based health information.